In this session, we are looking at a transitional cell carcinoma or squamous cell carcinoma of the bladder. This bladder was taken from a 67-year-old male who had an operation for a carcinoma of the lung 7 months prior to being admitted to hospital for investigation of hematuria or blood within the urine. A cytoscopy revealed a neoplasm at the fundus or base of the bladder. This patient died suddenly 3 days after admission to hospital. The specimen has been opened to show 2 large papillary tumours, one here and one here. Both of these tumours are situated near the openings of the ureters, this region here and this region here. Notably, this tumour on the right extends across the vault of the entire bladder. Both tumours also have broad bases, here and here, and many of the processes are thick and squat. We can also see areas of hemorrhage throughout these tumours, as indicated by these darker regions here and here. Microscopically, we will expect to see a malignant change in one papilloma, whereby the carcinoma is invading the bladder wall, such as this area here. Consistent with other malignant tumours, this squamous cell carcinoma consists of poorly differentiated neoplastic cells, as well as areas of fibrovascular development.
Next, we will discuss the microscopic appearance of transitional cell carcinoma of the bladder, or TCC. TCC is yet another example of an adenocarcinoma, as it is derived from primarily the proliferation of the epithelial cells which line the inner luminal surface of the bladder, shown here and here under the normal conditions. If you follow the bladder wall, you can see that it's made up of smooth muscle, and it actually folds back on itself, shown here, and then through to the other side. TCC is a very soft tissue type of tumour. It is generally fed by a single blood vessel, shown here, and smaller microcapillaries expand out into the soft tissue, as you can see in these fine tracts which lead into the developing cancer. One symptom of TCC is often hematuria, or bleeding into the bladder. Because of the soft nature of the tissue that's developing, any mechanical stress you can easily see would rupture some of this tissue and cause bleeding into the bladder. A higher resolution image of one of the papillae, which are growing off the bladder wall, shows that classically these are epithelial cells which line themselves on top of each other in a columnar fashion. Running centrally down the tissue is the area of the fibromuscular core which surrounds the capillary feeding blood into these neoplastic cells. So typically we see this adenocarcinoma derived from proliferation of epithelial cells lining the inner surface of the lumen of the bladder. And here we have high proliferation of epithelium which retains the columnar type effect of the normal epithelium, but in the sense of being highly proliferative, typical for this transitional cell carcinoma of the bladder.